Hi, I'm Colin Hung with Healthcare IT Today, and I'm here with Dr. John Robertson. Welcome to the program.
Thank you.
You're using eClinicalWorks. Talk to me how you're using it to have a difference or to make a difference in the patients' lives that you treat and also your own workflows.
Yeah, my own workflow is really the biggest thing with eClinicalWorks that I use is really the right side chart panel for us, which is point of care alerts. Point of care alerts and HCCs. The point of care alerts for us is a good way for us to actually take situations that patients have, whether they've not had a colonoscopy, mammogram, we've not captured a diagnosis code, they've not been filling a medication. We're able to address that and do that real time in the room with the patient.
And what difference has that made for you as a clinician to be able to do that?
A ton. It actually allows us to capture all the data, and actually I think we're only 10% deficient now when we were probably 40 or 50% deficient in point of care issues like colonoscopies and mammograms.
So it's really helped to improve both your workflows as well as the outcomes for patients.
You know, it improves the workflow, but really it improves the outcome. So I don't think since we've been using those things, I don't think we've caught like a cancer less than, actually it's been greater than stage 2 since we started. Before we would see stage 4, stage 5 cancers. Now we're able to actually elicit those people and screen them before they get to that point.
Incredible. Thank you for being on the program today.
Thank you for having me.